Again, good morning, everyone. My name is Jason Bliss, and I am the Executive Director for the Washington Alliance of Quality Recovery Residences. Today, I'm joined by a great team of Matthew, Kimberly, Scott, Dawn, and Darren. The topic of today's webinar is FCS, which is Foundational Community Supports. I know this has been a topic that a lot of you have requested. We have a lot of great information to cover in an hour and a half today. Just a bit of housekeeping stuff. If I could ask everybody to please keep yourself muted. If you have questions and such that come up throughout the webinar, go ahead and post those in the chat. If we're able to get to them right then, we will. If not, we will definitely have some time at the end to go over those questions. As I'm sure all of you notice, this session is being recorded today, and all of the slides will be available at the end, and we will share them all with you. Also, at the end of today's webinar, you will all be getting a short survey sent to you via email. If you could take a few minutes to fill that out, it'd be greatly appreciated as it helps us in moving forward. And with that, I'll go ahead and turn it over to Matthew.
Great. Thank you so much, Jason. This is Matt Christie with the Healthcare Authority, and I'm the supervisor of the Foundational Community Supports Program. And we all work in the Division of Behavioral Health and Recovery on the Recovery Support Services section. So we are part of the Recovery Support Services group. I've been with the program for just over 3 years now and have had a variety of roles from program manager to contracts administrator, and now supervising the team. And I'm joined here, and I'll just have everybody do kind of a little round robin on the HCA side, but I'll hand it over to my colleague, Darren.
Hi, good morning, everybody. Thank you for inviting us to share the information. My name is Darren Paskey. I'm the Supportive Employment Program Manager with a focus of West Side of Washington for trainings and technical support. I bring over 30 years of behavioral health and supportive employment knowledge and lived experience into this role, and I've been at the HCA for about 2.5 years now. So thank you.
How about Dawn?
Hello, everyone. I'm Dawn Miller. I'm actually located on the east side of Washington State, so I'm in Moses Lake. I have similar levels of experience to what Darren has, working in the Behavioral Health Agency, providing services related to supported employment for a lot of years, and I have a lot of passion for it. And that's obviously the reason why I'm here today. Darren and I both work with agencies to teach them how to do supported employment according to individual placement and support, which is the evidence-based practice of supported employment. So we do training, we do fidelity reviews, we see how well those agencies are doing compared to what IPS says they could be doing. And we help agencies to improve their outcomes. Glad to be here today.
Thank you, Dawn. And moving over to our housing team, Kimberly.
Good morning, everyone. My name is Kimberly Castle, and I'm actually in transition to a new role. My title is FCS Program Quality and Alignment Analyst. But for the last 4.5 years, I've been the Supportive Housing Program Manager for Western Washington. And so I will be here to talk about supportive housing with everyone today. Nice to meet you.
Thank you, Kimberly. And we have Kimberly's counterpart who isn't able to make it today, Rayanne Orbaum, who also focuses on supportive housing training for the east side of the state. And her contact information will be available for anyone on the east side of the state. And then last but not least, Scott, I'll let you introduce yourself.
Awesome. Thank you, Matt. Hi, everyone. My name is Scott Tankersley. I started here with the Healthcare Authority's Division of Behavioral Health in October of 2021 as the manager for the Foundational Community Supports Transition Assistance Program, otherwise known as TAP. I also have a history of housing case management that includes a Foundational Community Supports housing case manager stint of about 3 years in King County. So I know that program a little bit from the case management side as well, but happy to be here to talk about the Transition Assistance Program with my team today.
Thank you, Scott. Thank you, team. Now I'm going to see if I remember how to put on slideshow. And then let's kick this off. Oh, get back to the top. Let me know. I assume you can all see this.
Yep, it looks great.
Perfect. Thank you very much. So this is an overview of the Foundational Community Supports Program. We have quite a bit of information for you all today. And again, these slides will be available at the end. Here's a brief kind of overview of what we aim to talk about, a high-level introduction to FCS, who's eligible, how we manage our provider network, and talking about the outcomes and the, basically the principles behind the program and where it came from. An overview of our services. We've have our subject matter experts on the call today to talk about supportive housing and supported employment services, as well as the Transition Assistance Program, which is our flexible housing funds that Scott manages, and then followed by a Q&A session. And we hope to dedicate quite a bit of time to Q&A, as you all will likely have quite a few questions about what we have to talk about, and we're happy to provide any additional follow-up as well. So just jumping on in here again, I'm Matt. I supervise the FCS program here at the Healthcare Authority, and happy to give you this introduction before handing it over to my wonderful colleagues. So FCS, what is it? So these are two specific support services that are housed under the Medicaid transformation waiver that Washington State has. It's an agreement with the Centers for Medicare and Medicaid Services that's renewable in 5 years, or for every 5 years, we're able to renew this waiver. And what it does is it allows us to use Medicaid funds to demonstrate new support services, or at least that's how we've chosen to do it, and show their effectiveness in a variety of goals that we set out to achieve under the waiver. We launched in January of 2018, and since then we've just hit the ground running and have enrolled over 26,000 people. I think this was as of July. We hit that 26,000 mark across our services, and we've built a provider network of over 170 providers, with over 465 locations across the state. So a statewide benefit in terms of where people can access services. Again, we're housed under this Medicaid transformation waiver. We call it in Washington MTP, or the Medicaid Transformation Project. You might also hear the term Apple Health referenced in our presentation, and Apple Health is just what we call Medicaid in our state. So we are a Medicaid service. And really the goal is to help people remove barriers that prevent them from getting housing and employment and maintaining housing and stable employment. I mentioned we're part of the Division of Behavioral Health and Recovery, and we really do aim to support people in their recovery by addressing these social determinants of health, promoting self-sufficiency, removing those barriers to stable housing and employment, and really integrating into the community. For these two services, long story short, we had some legislation a few years before the waiver started that said we needed to follow and implement evidence-based practices when we create new services. And so in the design of this program, we chose two really complementary evidence-based practices for these services. They each have their own toolkit and really talk about, if you think about it, we like to refer it as like the recipe to get the right outcome for your meal. So if you have the right ingredients and you follow the right steps, you can get these really strong outcomes from the program. And as part of the waiver, we really do have quite a few goals and hope to demonstrate very specific outcomes to kind of show why we chose these services and why we chose these evidence-based practices, and to demonstrate the effectiveness of these new services. So on the left side of the screen, you'll see the individual placement and support, or IPS. This is our supported employment evidence-based practice, and our permanent supportive housing model is what we use for our supportive housing. I listed out the different principles of each of these, and I think I won't go through line by line because we'll talk about them in a little bit more detail later. But I think really just to show how complementary they are with the principles and also the services and what they offer. I think the most important, fundamental principle that we like to talk about with supported employment, Don, Darren, keep me honest here if this is what we need to, if I need to edit this, but we really, want to get the point across that employment is, everyone's included in employment. With the right job match and the right support, everyone can be employed. And similar for housing, we really believe in housing first with no requirements on readiness. If someone says they want to be housed and live in an apartment or an independent setting or wherever they want to live, we're ready to work with them and we want to support them to achieve those goals. I'm just going to pause there with my team. I saw Dawn nodding. I think we're on the right track. So moving on, now that we have our principles out of the way, who is eligible? So we are not an entitlement benefit at this point in the program. So what that means is anyone who's enrolled, or not everyone who's enrolled in Medicaid is able to qualify for these services. That's part of the waiver process. We have target populations, and we are really demonstrating how housing and employment services are a health, we're using health insurance, so it's a health need that we're addressing with these services. So we have specific eligibility criteria. You must be enrolled in Apple Health, which is Medicaid in Washington, 18 years or older for supportive housing, 16 or older for supported employment. And then we have a variety of specific health-based needs. Again, we're demonstrating the medical necessity of these services. So we have to meet that need to be able to bill Medicaid for these services. And I've listed a few of the health-based needs. Could be related to mental health or substance use disorder, needs with activities of daily living, or complex physical health needs that prevent someone from functioning independently. This could be someone who's maybe chronically homeless with a lifelong disability, for example. And then once you meet those health-based needs, we have also several risk factors that differ for housing and employment. I'm not going to go through all of them. Again, we can touch base a little later in the Q&A if we have specific questions. But these are types of things that, again, really narrow down who we want to be able to serve with this program. So on the housing side, people who have a history of chronic homelessness, they might have frequent or lengthy stays in an institutional setting, or a frequent, stay in a residential care setting. On the employment side, they could have a referral for the Housing and Essential Needs Program. Difficulty obtaining or maintaining employment due to physical or mental impairment or traumatic brain injury, history of substance use disorder with multiple treatments, etc. So again, a very specific target population that we established with the Centers for Medicare and Medicaid Services to show really where these services are going to make the most impact. Next slide. So we saw a bit about who is eligible. How do you get into the program as an enrollee? We like to say that we created a no wrong door approach to enter the FCS program. Anyone can be referred, they can meet the qualifying requirements, but anyone can be referred by maybe they're working with a behavioral health provider, a family member could refer them to the program. We get a lot of referrals from our program partners over at the Aging and Long-Term Support Administration. We sometimes refer or help people get connected to the program. I think the most of our referrals come from those individual referrals. So really you can enter at any point. You don't have to be engaged with specific services. We've really created a separate process to get connected to these services. I have a link to our quick reference guide, so that helps people evaluate who's eligible for our services. And all of these referrals are sent over to AmeriGroup, and they are our third-party administrator who is contracted to support the program. And I have a slide, I think, yes, on this. So the third-party administrator, they have several responsibilities. They're contracted with the healthcare authority to provide oversight of our provider network. They hold all of our contracts with providers. You can kind of think of it as like a health insurance network, if you will. If you have regions, they have a contract with providers across the state. It's kind of similar in that way. So AmeriGroup holds the contracts with our providers who offer supportive housing and supported employment services. They manage all of the service authorizations, payment of claims, and they also track and measure outcomes and help the healthcare authority and our program stakeholders with that sustainability planning. It's important to note that yes, AmeriGroup is a managed care organization, but no, you don't have to enroll with AmeriGroup to receive your health care in Medicaid. You can have any of the 5 health plans in Washington to enroll in FCS. AmeriGroup was just the successful bidder when we had a procurement back in 2017. And they've been with us since then and are really dedicated and build the program right next to us, dedicated to making it work. And so with that, just a little overview of our provider network. You can see that most of our providers offer both services. We have the number of contracts on the left, the number of locations on the right, and we do have a statewide coverage with that network. Here's just a screenshot. We have a provider map, and then we can provide the link to that as well. This is an older screenshot, but just gives you an example of kind of where providers are. A lot of providers on the western side of the state. That might not be a surprise to anyone, but we do have the way that it's set up is that a provider might be in one county, but they're able to work with people who are enrolled in counties that are adjacent to make sure that we have that statewide coverage. And we can maybe talk a little bit about that in more detail. But if you're interested in becoming a provider, we have some resources here to help connect you with AmeriGroup. Since they manage the provider network, they have a specific credentialing process that's outlined in our provider manual. I provided a link to their website with additional resources, information. It's kind of an abundance of information, actually. The provider manual also gets really in depth on the services, how to bill, what to do in a variety of instances if there are challenges or issues, but a really comprehensive overview of the program and what we are aiming to do. One other step I think just that we like to point out early on is that all providers must enroll in our Provider One database. This is our state Medicaid data system. And we have a separate process that's been created to help foundational community supports with this process, because we're also demonstrating not just these new services, but new providers in the community who can bill for Medicaid, who aren't your traditional healthcare providers who have an established history of billing Medicaid. I think it's worth noting that we work with all sorts of providers, nonprofits, federally qualified health centers, housing authorities, just community-based organizations, a whole wide range. So we had to create a separate process to help providers kind of shift their focus and get into this Medicaid world. So we're kind of demonstrating multiple things with this program and have had to come up with some unique processes along the way. But I think just in terms of information for potential providers, it's one thing to be aware of is that we do have quite a bit of Medicaid processes that we have to follow under the waiver. We do have some really strong outcomes from the first, I think this is back in 2021, with data from the first 18 months of the program. So we have a few different contracted entities to provide outcomes and reports for the waiver. And this comes from research and data analysis. There are a sibling agency at the Department of Social and Health Services, and they're contracted to do kind of the state's analysis of how the program's working. We also have Oregon Health Sciences University contracted to the waiver as a whole as our independent external evaluator. But I just listed for everyone's just high-level information that we have seen really strong outcomes so far. And this, again, was the first 18 months of the program, but it really, among participants in our supported employment benefit, an overall increase in the employment rate and hours worked and wages earned for our target populations. We saw decreased arrest rates among participants. And although it wasn't, we did see some decreases in utilization of emergency department and inpatient services. They weren't at the level that would be, from a data perspective or from a scientific perspective known as statistically significant. But we're working on working to improve engagement and work with those measurable outcomes to see those decreases that we had hoped to. But it's worth noting that the other first three on here are statistically significant. And similar on the housing side, we have significant and significantly positive impacts in helping people transition out of homelessness. We are seeing more people placed in housing projects funded by the Department of Commerce. And we're also seeing a higher rate of in-home care services among participants in our supportive housing services. Again, one of those things that we're hoping to look for, and we had seen some early promising results in the decrease in inpatient or emergency department utilization, but that is a trend that we're hoping to see as we get more data and as the program ages a little bit. But I thought it was just important for the context of this conversation to show that in the first 5 years of our program, we have been seeing really strong outcomes. And I think we can talk about the program as a successful program in that way. Just a high-level overview of some of the work that's coming up before I hand it over to my team to talk about the services. We're expanding our supportive housing services into mental health and substance use disorder IMD facilities. This is ongoing work. We have a few different initiatives under the waiver that work with IMDs. That stands for Institution for Mental Disease. For those of you who might not know, there's a specific facility classification for inpatient treatment. And we have 2 initiatives under the waiver that uses Medicaid in those settings. And so we're expanding our support services to help bridge people out of those inpatient settings. We have some funds to expand our supported employment benefit and the Housing and Essential Needs program, along with a big piece of legislation that we are working on implementing, and that's the Apple Health and Homes benefit that will launch shortly next year. That's a partnership between healthcare authorities, the Department of Commerce, that really, and we'll talk about this a bit more with our housing subsidy conversation, but if you look at what you need to have successful affordable housing, you need to have capital investment, brick and mortar units, and then support services. And it's a really intentional way of putting those 3 things together and providing housing and support services to people who are eligible for the Foundational Community Supports Program. And we're also in a period where we are applying to renew our 5-year waiver with CMS that includes the Foundational Community Supports Program for the next 5 years. Last but not least, with that renewal, we are proposing a few different changes or enhancements to our program. We're hoping to expand our eligibility for supportive housing to 16 years and older. It's currently 18 years or older. We want to also add a risk factor for our supported employment benefit to target people who are specifically exiting jail, prison, or who have a status of on parole. And lastly, we're hoping to use and to have a conversation with CMS to use Medicaid funds to pay for one-time transition fees to help people enter the community after receiving mental health or substance use disorder inpatient treatment. And this would be able to pay for things like first and last month's rent, your refundable or non-refundable fees, application fees, and things like that. And with that, I've spoken quite a lot, and I'm going to hand it over to my team to talk about supported employment. So let me hand it over.
Thank you, Matt. Appreciate it. Wanted to give you just a kind of a thought, perhaps. Individual placement and support is the evidence-based practice of supported employment. So it's the recipe that Matt was talking about that will get the best outcome related to helping people to find employment and maintain employment. At the point in time that Washington State started the process of working towards FCS, the employment rate of people with serious mental illness was about 14%. In utilizing IPS, it's bumped up to 40-something%. So certainly not 100%, certainly a whole lot better than it was. Individual placement and support was originally developed by staff from Dartmouth University for people with serious mental illness. But in going to the yearly international meetings related to IPS, we hear that there have been projects for veterans with spinal column issues, that paralyzed. And it's been used very. Okay, I didn't finish my coffee. I'm sorry. It's been used very successfully with that group, with individuals that have been referred from the DDA system. The state of Washington actually had a pilot project using IPS with people on TANF, parents on TANF that were looking for work. It has worked well with all of those groups. So even though it was originally written for people with serious mental illness, it works very, very well for a lot of different folks. So here are the 8 general principles. There's actually 25 principles if you look at the fidelity scale, but they're sort of lumped into these 8 for the most part. One of them is competitive employment is the goal. I know I've worked for 30 some odd years in supported employment, have worked with the population from DDA, have worked with the population of individuals with serious mental illness when I worked in a behavioral health agency. Long time ago, sheltered workshops were a thing. They're not now. I know when I worked as a program manager and when we paid sub-minimum wage, which means folks were getting paid a percentage of the wage that everybody else gets paid. That's heinous. Very honestly, it's heinous because they worked very hard and they actually worked above what that percentage would have paid them. So I'm glad that that's gone. We also helped a lot of people find volunteer jobs. And I know I've heard other trainers talk about the fact if you can volunteer and work, why can't you get paid and work? Competitive employment is the goal. Jobs in the same place as other people work and at the same rate of pay as other people get. And as Matt mentioned, and he's absolutely right, which is why I was nodding and smiling, he drank the Kool-Aid. With the right job match and the right support, I can say that anybody can work. And I say anybody. Over the 21 years that I was at the behavioral health agency, I think there were 5 folks that I said truly couldn't work, usually for physical health issues that had yet been resolved. So things like needed a back surgery or a shoulder surgery, or things just hadn't had the diagnostics done related to whatever was going on that prevented them from working. So very much anybody can work with the right supports and the right job choice. IPS supported employment is integrated with treatment. I mentioned it was developed for people with serious mental illness, which means it was also developed to be used in behavioral health agencies. FCS contractors are everything from Goodwill to community action programs and all the others that Matt mentioned. When we talk about integrated with treatment in the case of agencies that are not behavioral health, what we're asking agencies to do is to talk to the person about who supports you, who else in the community supports you, and then getting all of those people on the same page. And having regular meetings to talk and just share where the person's at related to employment. I've worked with people in the past when I had a caseload that, maybe they were working with an agency in the community that didn't have the same understanding as perhaps I do related to supported employment, and we're saying you can't work. I had one time a gentleman who had a doctor that said you can't work, but that was after I'd helped the guy to get a job at a security agency, being a security guard, and he was being very successful. So the doctor was relatively surprised. This helps to avoid that kind of thing. We get all on the same page. We talk with each other. We help the person in support decide who's doing what. And so it's important to do that piece of integrating with other service providers. Darren wanted me to do the first 4 because I have a story about zero exclusion that I love to share, and I'll make it brief. I see Darren smiling. Zero exclusion is just that. No one's excluded. If they say they want to work, we work with them to work. The scenario that I wanted to talk about, when I worked at the Behavioral Health Agency, I had a gal referred to me. She was actively using meth. The first couple of sessions that we had, she sort of kind of hovered over the chair for about 15 minutes and then darted out the door and said, "I'm done." And I chased her down the hall. I literally jogging down the hall to try and get another appointment scheduled. So after the first couple of appointments, and she came in and was starting to trust me at least a little bit, we discussed, what is it that you want to do? She said, "I don't know. I just don't want to be a drug dealer or a prostitute anymore. I want to do something legal." She'd been mugged from behind so many times. As you can imagine, she had serious PTSD and really didn't know what she wanted to do. So we did a very brief interest survey. And at the end of it, she said, "I want to be a welder. I want you to envision someone who had nice makeup, nice clothes, high heels." Welder didn't seem to fit, but I kept that to myself, as I should, because I don't make that choice. Helped her to get into college, which included working through having defaulted on financial aid in the past because of mental health issues. We worked through that. We talked to a counselor out at the college, and then talked to the head of the welding department, and discussed with them kind of, the hope, the wish, and some of the challenges. Because she'd been mugged so many times from behind, welding is done in carousel. So envision a 3-walled thing and your back is open. He worked it out so she left class 15 minutes early. She got to clean up and leave, so nobody was milling around behind her. She always got the back seat in the classroom, and various other things that, she ended up with a very good relationship with the instructor. Fast forward, she got her welding certificate for a 1-year program after 2 years of college, ended up getting a job at a scrapyard using a cutting torch with the welding gear and the boots and the chaps and the, leather gloves and the whole bit. Very successful. The guys there would just throw, things at her and she'd throw them right back because she wasn't intimidated at all. Her parents started interacting with her again, as did her adult children that had been taken away from her early on. She was in an NA group and was clean, and they became family as well. Everything about that scenario shows the power of employment and the reason why you want to help people. Over and above that, how do they pay for rent if they don't have an income? Because housing subsidies may not last. And if they don't, and they have a job and they can pay their rent, how powerful is that? Much more choice in their lives related to housing and employment if they have the opportunity to need coffee. I'm saying it's it's a must. And then preferences are honored. If any of you have been in a job that you hated, you know that preferences being honored is a really important part of this. The way we succeed the best, and I'm preaching to the choir here, is if you're in a job that you enjoy. And that's what we try and do with the people that we serve. They need to like the job. They need to have the skills for the job. In some cases, that means what's called customized employment for the people that have the biggest challenges. An example of that was a gentleman who liked to match things. As a table busser, he put all the salts on one table, all the peppers on another, all the ketchups on a third, and got fired. What he ended up with was a job at Nike where he matched shoes that were tossed in a huge box that nobody else wanted to do. That was his only job, and that's what Nike paid him for, and that was customized employment. So in that case, his preference was honored because he didn't have to do all the duties of being a table busser. He got to do that one job at Nike. Darren, over to you.
Thank you, Don. An important part of the foundation of the recovery process and employment is providing education and support. And a key element for fidelity is to ensure that people understand the benefits that they receive and how earned income will impact those benefits. And sometimes we have to also look at that support network, which could include families that may have fought for years to get somebody on these entitlement programs and are really fearful of what happens to those benefits as somebody returns to work. Definitely, I'm a proponent that you will earn more money over the long term than you're going to get in entitled benefits. But it's really important to start that education process using resources like the Red Book at Social Security, using the HCA Pathways to Employment website or the Pathways to Housing website to work on a budgeting tool to really provide some education. When I was out doing some training at one agency, I met a job seeker who just returned to employment, but he had gone to work and did not report his wages to Social Security. After a while, Social Security and the IRS finally get together and coordinate and learn information about job seekers and their employment. He had an enormous back payment of over $30,000 that Social Security would like to have back. Somebody did some great advocacy with the agency on this individual to get a payment plan of $25 a month, but this would probably go for the lifetime of the job seeker to pay that back. So I'm just sharing that because there are some important things to be mindful about. And one of the hardest things for some job seekers is to report their wages. It's still their responsibility or the family's responsibility, or maybe a payee, but to kind of look at that and continue to remind people it's part of the process and a really important piece for the benefit planning and education part. The next one is rapid job search. So this is not rapid job get, as my coworker Don likes to share, but it's that process of getting into the community and start the process. We really want to honor the person who's in the driver's seat, that we've learned what their strengths and abilities and maybe their dream job and maybe some of the jobs they've done before in going through a career process and looking at some of those key indicators. And then we, as an employment specialist, we want to be out looking and honoring that process. Some of it's gathering information. Some people may say they want a certain job but not really know the intricate parts of how to get that job or what the qualifications could be for that. So we want to be able to gather information and share and move out into the community to start looking at that. And that's where systematic job development comes in. It's a process that IPS looks at, is that we need to be in the community. We need to be having that employer engagement, that job seeker engagement in the community, and maybe do some role modeling on how that job search goes. Some role modeling of interacting with employers. IPS really looks at the 3 cup of tea process, where it's a process of engagement, not just going out and saying, hey, are you hiring? And how many positions do you have opening? But getting to know the employer and maybe some of the high turnover aspects of that business, some of the challenges that they might face, but just really building that relationship to get to know them so that we as an employment specialist can do some fine tuning to have a candidate that would really match that up. So IPS for high fidelity really looks at 6 employer contacts per week with hiring managers. So definitely for organizations, there's some data and tracking that goes a lot with this to really match up these goals. But those are some of the important criteria that FCS Foundational Community Supports looks at in terms of providing services and funding to allow employment specialists to bill for these services, being in the community and connecting with employers. Another aspect is what happens when somebody gets a job. We celebrate, but then how do we support them after that job start? And some of those critical components can happen from the 30 to 90 mark. So we really want to be able to have those kind of supports available, maybe job coaching on the job site, checking in with the employer, checking in with the job seeker, the job candidate. If we have a release, to do that on site, maybe off site, provide some of those coachings, to have some different strategies. IPS really focuses on that's time unlimited. It's up to that job candidate on the supports they need and how long. And FCS has some timelines just because their benefit period runs 6 months, and then look at doing a reauthorization or do some advocacy around that. But it's really important to kind of maintain that relationship, which can be really hard because sometimes people get jobs as like, I made it, I don't really need your support anywhere. And we're really looking for, some grit for supported employment staff to maintain that connection and follow up to kind of see how things are going and make sure, their success for the long term. Part of the process is not all jobs last long term, but an employment outcome success, we have to build upon that and maybe find a better job that matches the individual's strengths and abilities. So we always want to be available if things don't go well, or maybe somebody gets a certificate or a higher level of work experience and can move on and actually be promoted, maybe within an organization or other organization, that we still want to honor that process and help them with another job or educational component if that's needed. I think next slide, Matt.
PowerPoints are so much fun. So I mentioned that those eight principles kind of folded in everything from the 25 mostly. IPS encourages caseloads of 20 or fewer. Where Darren's talking about that time unlimited support, if you have a huge caseload, you can't provide the level of support that some people need. And so the smaller caseloads are more likely to help a person be successful. DVR is the federally recognized agency that helps people who with disabilities to find employment. Collaboration with DVR is important. It's been somewhat hard to do with them having been in order of selection, which just essentially means waiting lists. But it's still something that we encourage agencies to do. DVR has so many wonderful resources that would benefit individuals that are looking for employment, and so it only makes sense to collaborate. Employment specialists provide only employment services. I worked with an agency at a period of time. There was actually something called the 1915 B3 Waiver. It was another waiver that the state of Washington possessed to be able to have Medicaid pay for supported employment services. It went away. And my understanding is because it was not statewide, we made sure to address that with FCS. So the agency that I worked for had those of us that are employment specialists be case managers with a focus on employment. What ended up happening was when somebody lost their housing, when somebody had their meds stolen, when somebody had no food on their table and needed to go to the food bank or go to the doctor, I didn't do employment. In fact, I rarely did employment at all. So IPS has said, that the principle actually says that employment specialists should provide only employment services, and that employment specialist should be a vocational generalist. And that means rather than passing them from staff to staff to staff to do different functions, the employment specialist is supposed to do all the functions, from assessing the person when they walk in the door, to helping them find a job, to helping them be supported on the job, to collaborating with the other agencies in the community, all of that kind of thing. So the person isn't telling their story more than once. And they're also getting to know that person and trust that person, because trust is a component of any service that we provide. Building that rapport and building that trust is a huge thing. Darren, did you want to go over the other three?
Yeah, in terms of, fidelity, they look at high fidelity, spending 65% of an employment specialist time in the community. But we want to start people out, and we know this is growth. And sometimes, there's a lot of demand, just like Dawn was saying, on a staff in the community or staff in the facility working with folks and working with job seekers, but that's very high fidelity. And I've yet to see an agency meet that criteria here in Washington State. I've heard it's been met in other states. It's kind of like the unicorn waiting to see happen, but just getting the process and having people schedule their time that takes them out in the community, whether employment sites, the library, places to meet, going to DVR, reporting wages to Social Security, all of those things encompass that time in the community. Another critical element is about disclosure. When I was supervising a team, we had our organization on the business cards, and we encouraged employment specialists to share that information. So we were already disclosing we're part of a greater behavioral health network. So definitely having those communications with individuals, but having it ongoing, particularly when you're doing that employer engagement and job development and helping with interviews. We want to make sure people are aware of some of the rights that they have, as well as that it's a protected health information, and knowing when to share that and knowing when to be more reserved in sharing. And engagement, it's in conjunction internal and external with colleagues. It's definitely important to engage with people within the organization you work with, as well as those or businesses and educational DVR out in the community as well. So definitely there's certain elements that's really active engagement with these other services and in the community to provide those support services, because we all want folks to be successful on their journey to recovery and maintain the success as long as they can with holistic support for the individual. Did you need or want to add anything to that, Don?
No, sir. As always, you've done very well.
Thank you. Back to you, Matt.
And I'm actually going to hand it over to Kimberly to talk about supportive housing.
Thanks, Matt. So, hi, everyone. I'm happy to be here to talk about supportive housing, and I wanted to kind of address the different services that we offer within supportive housing. So just like the employment side, we have 7 principles of supportive housing that incorporate all the things that we want to do to address the services and the support and individual needs. We talk a lot about choice within our housing because we want an individual to really get to choose the type of housing that is best for them, right? So we know that when an individual has choice in where they live, they're more bought in and tend to do better and stay longer in that housing. So we talk a lot about that. And by doing that, we are able to utilize assessments to ask those questions. What do you need in your housing? What do you want in that housing so that we can best meet those needs, whatever that looks like, right? So maybe they need Oxford or recovery residents in order to address their recovery and stay well in that process. And so we want to ask those questions so we can support them in what that looks like for an individual. Supportive housing is all about ensuring people are getting wrapped around in their services, right? So we want to ensure that we are doing a lot of coordination of care to address what the individual's needs are, to make sure that we're looking at, are they working with behavioral health? Are they working with SUD clinicians? Are they trying to connect to rental assistance? We want to make sure that we are really doing the work to coordinate care with individuals to support them and making sure we're doing that wrap around and that we're all on the same page for somebody, because when we are all trying to do our own stuff, a lot of times that adds additional work to making sure that something happens in a smooth process. And we really want to work together to work with that individual to make sure things are running smoothly and that they get the needs addressed. We do a lot of development of community supports and supportive housing. So looking at making sure that we know what resources in our community and that how they can access them, right? So resources are always coming and going in each community. And so part of our job is to be on top of that, getting to know our partners out there, whether it's, furniture for someone's housing or rental assistance or, support in connecting to other benefits. So we want to make sure that we know where those are, how to locate them, and also how to teach our individuals where to access them so that they can do that on their own eventually without the support of us down the road. We're going to continually be doing treatment planning. So ensuring that we're looking at those short and long-term goals for an individual. What do they need right now? And also how can we reach those long-term goals, and what can we do as service providers to support that work? So, we look at, connecting them to rental assistance. Maybe it's getting ID so they can apply for permanent supportive housing once they transition from where they're at now. Whatever that may be, we want to create those goals with them and then help them reach them and continue to do that process until they no longer need our supports. We are advocates. All of us are probably in this work because we're natural advocates. We do it in our sleep. So we're going to continue to advocate for them and also teach them the skills to advocate for themselves. We have a lot of folks that maybe don't know how to do that right at the moment and really want to kind of watch how that's being done so they can learn to do that on their own. But advocating to, you know, to their landlord or to their primary care or to their mental health, you know, clinician and whatever that may look like. And so working on advocacy along the way. And then a big part of our job is that landlord liaison work. So whether it's connecting them to recovery residents or permanent supportive housing building, we're going to be working to find and maintain housing for that individual. That's really the goal of this benefit. And so one of the things we're going to be doing is always working with them to be able to mitigate issues with landlords, build landlord relationships in our community so we have lots of choice to offer an individual, and then be that kind of go-between as needed when issues arise or things need to be addressed within the housing. We want to be part of a partner in that process so an individual can stay maintaining that housing. And then of course, continuing to build those relationships with landlords in our community so people have lots of options when they decide to maybe they're done you know, living in recovery residence and they're wanting to go out and live independently now. Part of our job would be to help them kind of transition and do that work to find options for them out in their community. And then that financial skill building is really about, you know, helping people manage benefits, getting connected to rental assistance, maybe getting connected to supported employment because we want people to go back to work and be able to really maintain housing long term. In this market, that's really the best way to do that is get jobs and look at that. So really connecting to that supported employment piece and helping them kind of manage what that looks like. A lot of folks we work with maybe have never had to pay bills on their own or pay rent or so we want to be part of teaching them how to have those skills to do that and do that well. So part of our benefit is that pre-tenancy support, those things that we're doing to help someone get into that housing. And then the next piece is really sustaining those services, sustaining that housing, right? So what we're going to do is continue to do that coordination of care. Again, a lot of that is really around continuing to manage their rental assistance, whether that be a voucher through HUD or through the Community Action Council because they have a CBRA voucher, whatever that may look like, we want to help navigate those and continue to coordinate care with their other service providers. A lot of times once someone's housed, that's sometimes when the real work begins. A lot of times if you're working with someone that's been chronically homeless, the work really is, you know, they haven't had housing in a long time, if ever. And so maybe they don't know how to do some of the things that, that require of housing. And so really coordinating that care to ensure that they do well. Again, employment, that's not a post or necessarily a post service. That's something you can do at any time. Our belief is that it's a person's choice. So if they want to continue to work, if they want to do employment first, then we work with them to get employment first and then get into housing or vice versa. Everyone's a little bit different and we want to honor that choice as we know that that really empowers an individual to do it the way that works best for them. Those informal community supports are also very important. So, you know, a lot of folks that we meet when we first start with them don't have really informal supports. You know, they're really working with a lot of professional supports, and we want to help them to integrate into their community and really build those supports that they can lean on. Maybe we can't always be someone's emergency contact. You know, a lot of us work 8 to 5 or different, you know, hours within the weekday. And we want them to have people that they can get support from whenever and really have that community. A lot of times when you're working with individuals to begin with, they don't always feel like they belong in their community. And so we really want them to feel like they belong and that they're getting those connections to the community to really become part of their community and feel like they belong and build those relationships that help them want to be there and continue. Development of independent living skills. Once someone's housed, a lot of times we find that maybe they don't know how to cook, maybe they've never had to clean a house before or manage a household, teaching them how to be a good neighbor, how to be a good tenant. All of those things are part of what we do in supportive housing to ensure somebody does well and can maintain that housing. Again, advocacy, we're always going to be doing that. Treatment planning is going to be continual as we want to work with an individual to complete those goals, you know, and continue to look at what else can we do to support you in staying housed and doing well. And so, you know, until that they no longer have housing related goals, we would continue to work with them through that. We're going to help them increase their ADL. So maybe we have folks that, you know, need support in, you know, maintaining that house, like I said, or even just those daily routines of, you know, getting up, taking a shower, taking our medication, whatever those things would be to help them kind of get their schedule get them feeling like they can do these things kind of independently. And so a lot of folks we work with on those ADLs. Retention, you know, in supportive housing, we're always going to work with individuals to make sure that they're retaining their housing. So again, stepping in when there might be landlord challenges, tenant issues. You know, a lot of times, you know, we run across things, you know, issues with, oh, I'm sorry, ADLs, activities of daily living. Thank you, great question. I'm sorry, we live in acronym land here, so I apologize. Thank you for asking. We're always going to be working with retention to support individuals in maintaining that housing, whether it be that, you know, we're just mitigating those challenges with neighbors. And sometimes it means relocating them at times, right? Not all situations work out for folks. And so our job would be to support them in moving on without having to deal with an eviction and things like that that'll create additional barriers to them getting housing down the road, right? So we want to work with the landlord and the individual to try to do the best we can to ensure that they're able to do that in a smooth manner and without creating bigger issues for them down the road. And then again, benefit management, you know, a lot of our folks are navigating Social Security, you know, DSHS, all the different things they may be accessing. That can be extremely overwhelming for certain folks. And so part of our job is to sit with them and talk about that and help them kind of navigate those systems. I used to have an individual who would get her Social Security paperwork and her HEN paperwork, and they would contradict each other all the time. And it got so overwhelming, she would just stack them up in a corner and avoid them. And then she'd start losing her benefits, right? And we'd have to kind of go through some crisis to get those back into place. So we would spend her home visits going through her mail every week to make sure that we weren't missing anything, that she was turning things in on time, and really managing those benefits so that she didn't get overwhelmed and that she didn't lose out on receiving her benefits the way that she needed to in order to continue to live where she lived and move forward in her recovery. And then again, always working with the landlord. You know, a big part of our job in supportive housing is not only building relationships with community landlords, but also maintaining that, so that we can have good relationships with landlords, continue to house folks in those situations, and make sure that, you know, we're really there to not only support the individual living in those units, but also supporting the landlord who's allowing them to be there. And so really working together to wrap around that person to ensure that they do well and that they can stay there long-term, or as long as they choose to. So that is supportive housing in a really brief nutshell. If you have questions about the principles specifically or want to talk more about those services, please feel free to reach out and I'd be happy to spend some time discussing that further. And I think it's over to you, Scott.
Thank you, Kimberly. It sure is. Appreciate it. Hi, everyone. Scott Tankersley again with the Transition Assistance Program, otherwise known as TAP. Next slide, please. Before jumping into the what and why of TAP, I just wanted to highlight a few items, I guess, related to Washington's affordable housing landscape and the role of supportive housing services and housing subsidies, both short and long term. DBHR support services and short-term subsidy programs are really part of a larger ecosystem of affordable housing that involves brick and mortar rental housing, maintenance of that housing, and then services to support tenancies and subsidies that help make permanent independent rental housing more affordable for folks. And, you know, we know that the lack of affordable housing, a lack of brick and mortar affordable housing continues to inhibit many of the foundational community supportive housing enrollees and their ability to obtain homes they can afford across Washington. We also know that operation and maintenance of units helps maintain the quality of affordable housing stock in the state, and ultimately that ensures that units remain decent, safe, and healthy for folks to live in. And then support services like FCS tend to one aspect of housing instability and the related health outcomes that affect so many folks. And they really meet people where they are, ensure that housing choice is honored, and then they provide holistic support that aims to bolster those tenancies more long-term. And then rental assistance or subsidies, both short and long-term, play an essential role in linking folks with the brick and mortar places in communities and units of their choice. Ultimately, that makes those units more affordable when they're available for rent for folks. And so until recently, foundational community supports housing case managers out there working with the program had to work with enrollees to identify and locate certain resources that would lower or remove financial barriers to obtaining and maintaining affordable housing. But until now, until the TAP program, and so next slide, please, Matt. That begs the question, what is TAP? Well, we know homelessness is traumatic, cyclical, and it puts people at greater risk for physical and behavioral health conditions. And research shows that homelessness and unstable housing contribute to poor health. According to our affiliates at RDA, nearly 30% of mental health inpatient program recipients and half of SUD inpatient program recipients experience homelessness within 1 year of their discharge. Meanwhile, nearly 85,000 Medicaid recipients were staying in shelters on the streets or doubled up with friends or family or in places that weren't meant for habitation across Washington in 2020. And so searching for an affordable place to call home with limited resources while seeking, rental assistance programs to help pay for housing can be incredibly complex. And FCS supportive housing services and the additional flexible funding assistance that's known as TAP really aim to lower or remove those barriers to housing stability in a variety of circumstances. And so whether that person with a behavioral health treatment need is exiting an inpatient setting or living in the community as they await longer term rental housing resources, TAP can be a tool to lower those or remove those barriers to housing. And so with that, next slide, please. TAP, or the Transition Assistance Program, launched on May 2nd of this year as a flexible funding resource for enrollees of the FCS Supportive Housing Program. And the program provides funding support to FCS Supportive Housing enrollees experiencing behavioral health treatment needs who are also seeking to make housing transitions. And the program, like I said earlier, really aims to lower or remove financial barriers to housing stability. TAP funds were born from the state legislature and the general fund. About $3 million per fiscal year, or just over $6 million total, was appropriated for the program during the 2021-22 biennium. And the fund, which is administered by AmeriGroup, can be drawn upon by FCS supportive housing providers as FCS supportive housing enrollees take steps to achieve their individualized housing goals. As the third-party administrator, AmeriGroup reviews provider spending and reimburses providers when funds are spent on behalf of FCS supportive housing enrollees. Next slide, please. And so, who is eligible for TAP? Well, an individual must be actively enrolled in FCS eligible Medicaid, and they must be authorized by AmeriGroup to receive FCS supportive housing services. Enrollment in FCS supportive employment does not trigger the ability to access TAP, but TAP right now truly only serves folks enrolled in FCS supportive housing at this time, but quite a few folks are enrolled in both, and they tend to lend or assist each other in a holistic way. I've seen some requests come in, from the employment side, really connecting the dots to how that employment need that TAP is connected to a housing related need that TAP can cover. And so I just want to mention that in this space. The enrollee must also identify as having a behavioral health treatment need, but validation or verification of behavioral health treatment need is not required. And that's really due to the fact that the broader FCS service program uses behavioral health treatment needs as eligibility criteria. Therefore, it's already been validated. The screening or approval process is performed by providers themselves for TAP. And so since a person must be actively receiving FCS eligible Medicaid at the time of a transaction or service, providers must check an enrollee's Medicaid status in Provider 1 before spending TAP funds. And so if you were to become an FCS supportive housing provider, you would be linked with some information on how to gain access to Provider 1 and make that check. Next slide, please. And so TAP offers supportive housing enrollees up to about $5,000 in funding on a rolling 12-month cycle. And when I say a rolling 12-month cycle, I mean that exactly 1 year after a TAP payment is made, that cost no longer counts towards the amount spent by the enrollee. So if my agency, let's say, makes a payment today on behalf of an FCS supportive housing enrollee in the amount of $4,500, then a year from today's date, that amount would fall off their expense record, essentially freeing up that amount to be used by the enrollee, so long as there are funds available still at that time, and that enrollee is still enlisted to receive FCS supportive housing services according to Provider 1. And so with that, there are a few different ways to spend money with the program. So we do have one way, which is kind of abiding by this quick reference guide that I'm going to speak to here in another moment. But then there's also this exception to policy kind of process as well. And so when the exception to policy, or ETP, is used, it really brings more flexibility to spending TAP funds. They really offer providers and enrollees the chance to flex the spending beyond the scope or the menu on that quick reference guide that we've created here, and that FCS providers have been given that quick reference guide. And I'm going to, in fact, post the link to that quick reference guide towards the end of the session, just so folks can poke around a bit. But the quick reference guide, it really encourages timely spending for costs like application fees, IDs, and certain housing costs like first and last month's rent, security deposits, those non-refundable fees, and more, which oftentimes are barriers that pop up to someone obtaining a unit in a quick and timely way. Other items like home modifications, home sustainability items, and others are only requestable by that exception to policy request process or ETP process. And I'm going to run through that in more detail here in a second. But TAP really aims to provide shorter term funding to cover housing costs, and that means ongoing rents cannot be paid with TAP. But that said, TAP really aims to be braided, or I like to use the term consciously coupled with longer term rental resources when an enrollee expresses that that's part of their path towards housing stability. And while you'll notice some overlap between TAP and some of the short and longer term rental resources in the state, TAP is flexible in that it aims to cover some of what those other programs do not. And we also hope that TAP can help maximize longer term rental resources like CBRA, or the Community Behavioral Health Rental Assistance Program, which is managed by Commerce, and others by covering certain costs as individuals search for and identify affordable housing of their choice. Again, that ETP process really kind of lends itself to flexible spending, but the quick reference guide is going to be the place to go for understanding how quick and timely payments can be made. So next slide, please. So here is the quick reference guide. Let me see if I can post this real quick so folks can feel free to explore on their own. So this document informs providers up to how much can be spent on certain housing related costs. And this was developed to facilitate that timely spending. When a provider has the TAP quick reference guide in their possession and they've checked to ensure an enrollee's Medicaid is active and FCS eligible, then they can go ahead and feel confident in spending. If a cost can be covered by TAP, it's going to be listed on this sheet. And so they can feel confident in spending that money and the fact that they'll be reimbursed up to the amount that's listed on here. If any amount on here, or if the cost of an item is over an amount listed on here, or you don't see something on here, that is where those ETPs, or exceptions to policies, step in. But real quick, IDs and other documentation up to $80 each can be spent. Application fees up to $100 each, and that includes background checks, credit checks, and such. Certain transitional housing fees up to $100 each right now. I know your analyses fees kind of pop up here and there, and that's a way to quickly lower those barriers. And then moving expenses, we have some funding for that. Up to $300 total can be spent according to the quick reference guide. And then move-in assistance, up to $5,000 can be spent on fees to enter a rental unit. TAP covers first and last month's rent, deposits, non-refundable fees, and then fees can be annualized and covered if the annual price is brought into the lease. So say like a parking fee for one car or something like that, rather than it being like a monthly charge. If that landlord would be open to annualizing it and including it on the lease, TAP would be able to cover that as well. Next slide, please. And so exception to policy requests, or ETPs, they just started about a month after the actual program started, and really provide a lot more flexibility for TAP. So again, home essentials and sustainability items, including reasonably priced mattresses, small household appliances, maybe some light furnishings or cleaning supplies. Those are kind of what we're thinking with those fees. Home modifications, when I see bed bug remediation, that is something that we could approve through an ETP process if it's requested. But yes, it is something we welcome as a request, and would be most likely approved. If some specifics were given, we might ask a few questions around that, just so you know. But requesting TAP funding through the ETP process involves providing a brief narrative documenting the housing transition, or the current circumstance, I guess, of that person. So in the case of bed bug remediation, you might just want to kind of give us an understanding of what happened and what steps need to be taken to get the bed bugs out of there, and then also how that's going to, improve the person's kind of path, I guess, on towards permanent housing stability. But yeah, so enrollees have about 30 days after a move to request those home essentials and home modification items too. I just want to put that in there as a little caveat. So we're expecting folks to be submitting those requests within 30 days. Next slide, please. So TAP funding aims to lower barriers to housing security for all FCS supportive housing enrollees. And some may be entering a unit where they can afford ongoing rents, while other enrollees receive fixed low incomes and oftentimes cannot afford rents in their region. And so for enrollees that are seeking to use a longer term rental resource, TAP can cover costs that some other longer term rental resources do not. TAP can cover, like I said earlier, first and last month's rent, deposits, and non-refundable fees for programs that don't cover those. Oftentimes, housing choice vouchers do not. We also seek to cover common pre-tenancy costs like application fees and IDs. TAP can cover short-term hotel motel stays for up to 30 days via ETP if a person has a longer-term housing resource being offered to them, and or if they have a voucher and they're searching. The program can also cover certain costs upon a person's move, like a reasonably priced mattress, like I said earlier, sheets or pillows. We really want folks to be thinking kind of outside of the box on some of those items too, and making those requests, because we do understand that not everyone, needs the same exact thing each time they move into a unit. And that's kind of how TAP seeks to work. It seems to meet people where they are and kind of work, to purchase those unique items or services or goods, excuse me, not services, but those goods in a way that fills that gap or that need. And so with that, there's one more slide, I believe, that kind of just gives a brief overview of the program, or not. Maybe it got taken out. But with that, I would love to hand it back to Matt so that we can take questions.
Sorry, Scott, I must have dropped off when I was making some edits earlier, but did you want to touch on that? I think we have just a moment or two.
Yeah, I can just touch on it. It was just a quick recap of TAP. So, the program really provides funding support to supportive housing enrollees in the FCS program specifically. The aim of the program is to lower or remove financial barriers to housing stability for those enrollees. And enrollees must be connected to FCS supportive housing services according to provider one on the date of the payment before any payment can be made on their behalf. And then once it's confirmed that a person is connected to supportive housing in provider one, providers can spend according to that TAP quick reference guide. And then ETP is allowed for that more flexible spending in the TAP space. Thanks.
Thank you. And thanks to the whole team for joining today to talk about the Foundational Community Supports Program. Now I think is the space that we've created for Q&A, and I'll just point out before I stop sharing my screen that we just have everyone's contact information available at the end of the slideshow.
Yes, I want to thank all of you. That was very, very, very informative. If any of you from the audience have questions, please go ahead and just post them in the chat or use the hand raise feature and we will call on you.
Well,
yes.
While folks are thinking, I'm sorry. I was just going to say I would like to address, Florence brought up some great issues related to individuals with justice involvement and supportive services. That's actually part of the proposal for the FCS changes. I'm thankful to say, because it has been, distressing to all of us that we couldn't help that particular group, but hopefully that'll be approved and will be up and coming. One of the things that's happened in the state of Washington in recent years is the ban the box legislation. So I'm very happy to say they can no longer put that on applications. That doesn't mean that employers don't do background checks when they hire people. But when you have a supported employment specialist working with an individual that has justice involvement, they keep that in mind when they talk to employers. Very often when we talk to employers and we start talking about when we get to know them a little bit, talk about individuals we've served and perhaps bring up justice involvement, we'll hear things like, oh, geez, I had a brother, or I have been, or whatever. So it takes that multiple contacts with various employers that are of interest to the person to find that right scenario. But that's part of what it's about, is to continue to pursue talking to employers until you come up with that right scenario. So there's a lot of, when I had a caseload, the greater majority of people on my caseload had either substance use disorder issues or justice involvement issues, or both, sometimes very significant challenges. The nice thing about IPS is we don't say a person has to be perfect. If they said I had to be perfect, I wouldn't have my job now. That we work with the person where they're at and work with the skills, abilities, and interests that they've got. If a person is truly motivated to work, you know, if they want to, we can work with all the rest of it. And I say we, the providers can, but both Darren and I have done supported employment, and much like the gal that was actively using meth and became the welder, we just worked through one challenge at a time.
Thank you, Dawn. And Amanda, a copy of the PowerPoint slides will be emailed out either today or tomorrow to all of the participants. And yes, the transcript will be available at that same time. Let's see here, looking at some of the other messages or questions. Xander had posted, I'm curious to know what factors contribute to so few providers being attracted to FCM. I'm assuming FCS in Eastern Washington. I'm assuming part of it is population distribution, but are there other factors?
And that's a good question. And I don't know that we've ever surveyed to get exact answers in regards to the difference between the one side and the other, but population is definitely a huge part of it. When we mentioned that FCS is across the state, each of the areas of the state in Eastern Washington have a provider. I think I can't remember which county it is. I think it's Garfield, that only has one. Yeah, I may be wrong on that. This has been good for my geography working in this position. But there's one of the counties that only has one town in the whole county, and a neighboring county provides service to that particular county.
Thank you, Dawn. Connie had a question. As a new staff member, I've been informed that I need to get on the list for renewing authorizations for FCS clients. Who should I contact and their contact info?
That might be a question that I can help answer. I think in terms of reconnecting people to the program, we ask that you work with your FCS manager at AmeriGroup, and they'll work with us at Healthcare Authority when someone's identified as either being disconnected from services for a variety of reasons, and work to re-enroll them in the program. So we would recommend starting with your FCS manager at AmeriGroup.
Thank you, Matt. And Matt, I think you covered this, but just to recap a little bit, even though AmeriGroup is the one that has the FCS program, if a client falls under any of the Apple Health insurance that are out there, they're still eligible for this program, correct?
That's correct. You can be enrolled in any of the 5 health plans in order to receive your FCS services. We just have AmeriGroup. It's a separate team. I think it's also important, worth noting, that is responsible for overseeing FCS. It's not the managed care side of their business. We do benefit from a lot of the managed care processes, especially when it comes to Medicaid billing, but they are separate from the managed care side, and you can have any of the 5 health plans. And I think I saw another question just about the time it takes for enrollment. And the turnaround time is usually 2 to 3 weeks. Once you receive an authorized, or I guess that kind of depends. The length of
time it takes to get an authorization is pretty quick. The turnaround time, I believe, is within 5 business days. But we ask that you wait 2 to 3 weeks before starting to bill FCS with a new enrollee, just to make sure that we have all of the enrollment pieces in place at the state so you can start billing. Again, that's around the 2 to 3 week mark. But the service authorization, as soon as you have that from AmeriGroup, you're able to start serving that person right away.
And Matt, are there specific software platforms that, for instance, a housing provider may need to be able to bill for these services, such as Keynotes or any of the other, what I want to say, sophisticated billing platforms that you see a lot of the behavioral health organizations have?
That's another great question. We do have the option to use any sort of clearinghouse that you might already be using. We do also have some providers doing paper billing. That's also an option. But through AmeriGroup, they have made Availity available. So the name is, I'll type it into the chat. Availity. That's spelled correctly. And that's a free platform that you can use for FCS billing that's available through the FCS program at no cost.
Great, thank you.
Hey, Matt, I just saw ask a question if there is placement for these families, and if so, where? And I thought maybe you might want to speak to the connection to, you know, bricks and mortar housing and how FCS services doesn't necessarily have any for the program specifically, but also maybe you could touch on Apple Health and Home.
Yeah, I might need a little bit of extra context for the families portion. But we do have, so I think one of the things that we're working on is more streamlined connections with different services and different funding opportunities that are available across the state that support individuals and families in getting stable housing. Kimberly, I don't know if you're still online, you might also be able to add to this a bit. We work really closely with different programs in the division. I know we have a recovery and community section on our team that has different housing first programs that they fund that can work with communities. And then in terms of actual placement into housing, I think, you know, it's no surprise that just access to housing is a huge barrier, and just the lack of available inventory. And that's really where I think the legislature sees the Apple Health and Homes benefit, filling the need for that. Again, creating new units that are permanent supportive housing units across the state that have a rental, you know, subsidy tied to that, as just a really deliberate way to provide housing, affordable housing to people who are enrolled in Medicaid and receiving FCS services. Just really, again, chronically homeless. We have almost a third of our enrollees are chronically homeless. I think at any given point, 50% or so of our enrollees are seeking housing or actively unhoused. So again, just one of those areas that we're always looking for better alignment and better engagement with other funding sources.
Thank you, Matt. Mariana had a question. My apologies if I missed this part. Working while listening in. I was wondering how people find out how to turn to you guys, and or what resources do they have when in need? And is there a way we could get a copy of all support available to actively go out to the community and help folks? Thank you. Mariana, can you basically expand on that a little bit? When you speak of the resources, which resources are you specifically asking about? Are you asking about FCS resources as a whole?
I'm just thinking about in general, we just recently met, and I do strategic real estate, and I have a lot of clients with a lot of money who are ready to jump into this. And I'm putting together a program for myself as well as my clients to faster enter this program. There are a lot of people who want to help. And I was just wondering, I'm trying to look at this from the comprehensive standpoint of we run into people in need in our personal lives. And I wonder if there would be a sheet I could give them that these are the people you need to contact as an individual to enter into this program, and then you can come to us. So, because like we do a lot of nonprofit, I do a lot of nonprofit work and a lot of help in general. So I run into people on the street and through like different people who are connected to the homeless community. I believe a lot of people in the homeless community doesn't even know they have this option, or if we can. I don't know. I'm just keep thinking that how could I get a wide range of information to put together an application process and also funding and the whole 9 yards to streamline the process to housing on every which way.
Well, my colleagues are thinking, Mariana, I posted in the chat. We have housing and employment resource sheets that we can send to you along with the PowerPoint. The Pathways to Housing and Pathways to Employment websites have amazing amounts of information and resources. Kimberly, Darren, Rayanne, and I are always welcome the idea of consulting with us. So if you have a specific individual with specific challenges, unaware of resources, and I think we're all pretty good about knowing resources, you can feel free to consult with us. We can do additional training. I also ended up recently getting from the CSD office, the Community Services Office, a resource guide that I would be willing to also attach when we send out our slides. So there's just a huge variety of options available to learn about those resources, but keep us in mind as individuals that are available to help you to find those resources specifically for individuals.
Thank you so much, because the more I'm getting engaged with your program, the more I'm thinking about tapping into my own network. For example, Amazon HR, like there is a diversity group manager that I'm on my private club board with. So I will, like, the more I'm learning and I'm learning the needs, I think we can also go out and help find these people who can employ these guys, because I'm hearing like employment is needed. And I have a lot of commercial, not just residential, but commercial real estate clients who are in manufacturing situation or have a hard time finding help in a restaurant and production. So I can reach out to my network to see if they would be hiring these people. So I'm just trying to think the bigger picture of how many which way we can help.
The very best way for any of us to get employment is still networking. So good for you for thinking about that. That is perfect.
And I would say the same goes for housing. I tell people all the time, if you're struggling to find housing for an individual, attend the homeless task force meetings or stakeholder meetings in your community to connect with other providers that may have landlord resources that they want to share. Connect with your inner circle, churches, folks you get your hair done by, those kind of personal communities also have a lot of times have connections where we can access to get additional housing stock for our individuals. And just, going out and doing what I call resource scavenger hunts. I tell people it's a great team building activity to send folks out and gain new resources in their community to support our individuals. There's always something new coming on board or something, leaving that we need to be informed about. So spending some time to really block out to gather those resources is so important for our folks. We have a ton of resources that we can support you with getting. We have our Pathways to Housing and Pathways to Employment, like Dawn said. And then, of course, if you reach out to us, we can connect you with other stuff. There's even a website called findhelp.org. I don't know if you guys know about it, but you put your zip code in and it connects you to a bunch of resources in your community, whether it be housing, employment, food, all sorts of things. So there's lots of ways to connect with those different resources, but we'd be happy to spend some time with you on the side to talk that through and places you can tap into resources to really best support your individuals. There's always something new coming around, so.
Out of being mindful of everybody's time, I want to thank everybody for your attendance here today. I know there were a couple more questions that got posted here in the end. I'm sure that Scott, Matt, or any of the rest of the team there, the FCS providers, would be happy to answer all of those for you. Again, on behalf of Walker, I want to thank all of you for your time today. Matt, I want to thank you and your whole team. You guys did an amazing job, and a lot of great questions got answered on FCS. We're going to be holding a lot of informational and professional development webinars here at Walker. All of those webinars can be accessed in our upcoming trainings on our website at www.waqrr.org. On behalf of Walker and everyone with the HCA that was here today, again, I want to thank you all for your time, and we look forward to seeing you on our upcoming webinars. Be safe and be well.
Thanks, everyone.